The news day continues here on One News Now. I'm Sean Yao. The Senate has started its hearing into the spending deficiencies of the Health Department as flagged by the Commission on Audit, or COA. For the latest, Man Los Baños joins us live from Mandaluyong City. Hi, Man. What were the key takeaways from the Senate hearing so far?
Hi, Sean. Good afternoon. Among the issues tackled in today's Senate hearing was the distribution of the special risk allowances among healthcare workers. Filipino Nurses United, or FNU, said many nurses have yet to receive the benefit promised to them under the Bayanihan 1. But Health Secretary Francisco Duque explained that they have already distributed the allowances, but only to the healthcare workers who are in direct contact to COVID-19 patients or those assigned to COVID-19 wards. Duque said this is in accordance with the law. But the FNU refuted his claim, saying that many of their members assigned to COVID-19 wards still await the payout. The senators, for their part, questioned why the beneficiaries are only those exposed to COVID-19 patients, when in fact, all the workers in hospitals are generally at risk at getting the virus. Duque responded by saying that if only they can manage to give benefits to all hospital employees, they will do so. But Commission on Audit Chairman Michael Aguinaldo explained that it was the DOH itself that crafted the guidelines. With this, they can change the definition of the beneficiaries and just inform the COA about it. Sean, let's listen to some of the statements of officials present in the Senate hearing.
We don't want to play God. We are assuming, and my colleagues can bear me out on this kung they agree with this, we are assuming that COVID respects no boundaries, respects nobody. Kung madaanan mo, tepo ka, lalo na itong mga bagong variant.
Well, we agree, and my problem, Mr. Chairman, is that the resources, once shared across many more individuals or healthcare workers, baka naman walang impact yung kanilang makukuha.
Sean, some senators also suggests to Secretary Duque to use part of the DOH savings to continue providing risk allowances so that the healthcare workers can continue enjoying benefits even after the Bayanihan 1 law has expired. Sean?
All right, thank you so much for that update. Looking forward to the next one. Man Los Baños of News 5 joining us live from Mandaluyong City. In other news, the Information and Communications Technology Department, or DICT, insists that there were no irregularities in its purchase of gadgets worth 170 million pesos. This is also after the Commission on Audit, or COA, questioned the DICT's procurement of gadgets from a construction company. In a statement, the DICT explained that Lexmar General Merchandise and Contractor also engages in the wholesale of office supplies and equipment. In its 2020 report, COA said that Lexmar had insufficient funds to finance the entire project, which makes the transaction doubtful. COA also questioned the company's involvement in the supply and delivery of gadgets when, in fact, it caters to general construction. And Metro Manila mayors will be leaving it up to the IATF to decide on the next quarantine status across the capital region. MMDA Chairman Benhur Abalos said they did not come up with a recommendation because they are not sure if the government can still afford to provide ECQ ayuda. NCR mayors vowed to continue their COVID testing and vaccination efforts, whatever the next quarantine status may be. The 2-week ECQ period in the capital region is set to lapse on Friday, August 20. We're pausing for a quick break, but we will be back with more stories after that. Stay with us. You're still watching One News Now. I'm Sean Yao. Some hotels in Tuguegarao City are now serving as holding areas for COVID-19 patients as hospitals remain full. Romel Lopez joins us live from Tuguegarao for more details. Romel, how are hospitals there holding up? Are there a lot of cases down there or up there in Cagayan Valley?
Yes, Sean, hospitals here in the province of Cagayan are now almost full and patients are now lining up just waiting to be admitted. In Cagayan Valley Medical Center, 282 out of its 350 hospital beds dedicated for COVID patients are now occupied. All 70 beds for ICU are now 100% utilized. The hospital has put up makeshift tents outside the building in order to accommodate more patients. Despite this, ambulances and other vehicles carrying COVID patients continue to line up outside in hopes of chancing upon available hospital beds. They have no choice but to count on oxygen tanks while waiting for their turns inside their vehicles. So far, Cagayan has over 3,000 active cases, with Tuguegarao City having the most number of active infections at 1,069. The province has tallied over 618 COVID-related fatalities, 18 of which are new ones. As the cases continue to rise, more and more health workers are getting infected as well. In CVMC alone, more than 100 of its medical workers have
Ngayon po talagang ramdam na po natin yung tinatawag nating toxic. Dahil kung bukod po sa manpower, talagang kinakaya po namin ito na kahit na hirap na po kami para matulungan lahat ng ating mga mamamayan, ay talagang kailangan naming magsakripisyo.
And Presidential Advisor for Entrepreneurship, Joey Concepcion, has renewed his proposal to only allow fully vaccinated customers in some establishments. Concepcion said this move will create a micro-herd immunity ahead of the target vaccination of 70 to 80% of the country's population. He explained that this will not be discriminatory among those who are unvaccinated because their movement needs to be limited for their own protection. Concepcion is also in talks with the DOTR on the possible segregation of vaccinated passengers in public transportation.
What we need to do is to create micro-herd immunity. We don't need to wait for micro-herd immunity towards October, November. We can do it now, and that's being done now. As the LGUs vaccinate more people in their respective areas, as us in the private sector.
The health department has reported more than 11,000 new COVID-19 cases on Wednesday. This has brought the total caseload to 1.77 million, some 105,000 of which are still active. The DOH said the relatively low case count today is due to lower lab output last Monday. 161 people died of the virus in the last 24 hours, bringing the death toll to 30,600. Recoveries are now at 1.64 million, with 11,600 new survivors logged overnight. 74 cases previously tagged as recovered were reclassified as deaths. 23.4% of the 46,600 that were tested for today's bulletin yielded positive results. For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News Live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.